Empowerment Experience continues with a special panel discussion, Women's Wellness, Healing Ourselves, Healing the Village, moderated by Andrea Lawful Sanders, part of the 2021 WURD Empowerment Experience, the power, purpose, and possibility of Black women, conversations about healing and wholeness, exclusively on WURD Radio, 96.1 FM and 900 AM WURD, streaming live on WordRadio.com, the WURD Radio app, or watch live on WURD TV via Facebook.
Good afternoon. This is the 2021 all-virtual WURD Empowerment Experience, the power, purpose, and possibility of Black women. Conversations on healing and wholeness. Listen for our words of empowerment featuring the voices of Black women from around Philadelphia, uplifting and inspiring us throughout the day. That's the 2021 Empowerment Experience today until 5 p.m., exclusively on WURD Radio, 96.1 FM and 900 AM, WURD, streaming live on wordradio.com and the WURD Radio app, or watch live on WURD TV via Facebook and YouTube. We are sponsored by PICO, Comcast, Keystone First, Temple University, Einstein, PA Lottery, Spectrum Health, Philadelphia Museum of Art, Independence Blue Cross Foundation, and Envision to Be Well. The WURD Empowerment Experience is supported by the Racial Equity in Journalism Fund at Borealis Philanthropy. Good afternoon. I am Andrea Lawful Sanders, the host for The Source, aired on Mondays, Tuesdays, and Thursdays from 1 to 4 p.m. And this afternoon, I am welcoming you to the Women's Wellness, Healing Ourselves, Healing the Village panel. It was bell hooks that made this quote that I wanted to read to you. The political core of any movement for freedom in society has to have the political imperative to protect free speech. To be feminist in any authentic sense of the term is to want for all people, female and male, liberation from sexist role patterns, domination, and oppression. The wonderful bell hooks transitioned a few days ago, and I felt that it was important to start the programming this way. Let me introduce you to the panelists. I am super excited. Some of them I know quite well, others I am just meeting for the first time. Latasha D. Mays, MSPPM, is a nationally recognized leader in the field of reproductive justice, human rights, and leadership development for Black women and girls. Latasha is the founder, president, and CEO of New Voices for Reproductive Justice, a multi-state organization in Pennsylvania and Ohio dedicated to the health and well-being of Black women, femmes, girls, and gender-expansive folks. New Voices advocates for the human right for all people to control their bodies, sexuality, gender, work, reproduction, and ability to form their families. New Voices will soon celebrate its 18th anniversary, having organized and served over 200,000 constituents. Dr. Sean O. Ross is the Executive Director of Health Equity at Independence Blue Cross. In her most recent past role, she was the Chief Nursing Officer and Senior Vice President of Master Service Provider Operations at Ingenesis. She also worked in health policy with the previous presidential administrations, Obama and Trump, as the Director of Nursing Practice and Work Environment at the American Nurses Association. In her most recent clinical role, Dr. Ross was the Vice President of Clinical Operations for AL Health in Washington, D.C. Prior to this role, she was the Director of Patient Care Services at MedStar Harbor Hospital. Dr. Anuli Emparu, for the past decade, has been recognized as an orthopedic surgeon who practices compassionate, evidence-based medicine. Upon completion of her undergraduate education at Texas Lutheran University, she attended Columbia University, where she graduated with a Master of Science in Human Nutrition. She went on to graduate from Duke University School of Medicine, where she won multiple awards, including an Alpha Omega Alpha National Honor Medical Society Award. She was the research fellow at the Center for Orthopedic Research at Columbia University's College of Physicians and Surgeons, and she presented her award-winning research at several high-profile meetings, including the Massachusetts chapter of the American College of Surgeons. And oh, her bio keeps going. It's amazing. I'm going to leave it alone. Marion A. Frey is Chief Executive Officer with Maternity Care Coalition, someone I met recently. Marion leads the day-to-day affairs of MCC, a 41-year-old community-based nonprofit. MCC serves pregnant and postpartum women and parenting families impacted by racial and social inequities throughout southeastern Pennsylvania. MCC's mission is to improve the health and well-being of our families while enhancing the school readiness of their children ages 0 to 3. Good afternoon to each and every one of you. I had to get that out of the way. I hope I served you well. Good afternoon.
Yes, thank you.
Good afternoon.
Good
afternoon.
Now, if you have watched The Source, then you understand that women, Black women, the role that we play in the lives of each other and the people that we love so dearly we rest on our shoulders. This morning, I was in a huge conversation with some young people and police officers, and what I learned broke my heart. What they're saying to me is, our mothers, we don't tell our mothers the things that we need to tell them because we think our mothers are too stressed. We think our mothers are already dealing with more than enough. And so as they continue to deal with depression and anxiety and all the other things that are going on around them, they're recognizing that Black women are dealing with more than enough, and so they opt to find other ways to deal with their own stresses. So today we're going to talk about our wellness, healing ourselves and healing the village. My Lord, where do we start? Can we start with the reproductive health and the politics around it and the fact that abortion has become a hot topic long after it's been decided that, you know, we had the rights to our bodies? Latasha, I'd like you to start, and if anyone would like to chime in there, that would be perfect. Welcome, all of you.
Thank you so much. I am so honored to be here and be a part of the empowerment experience. We at New Voices for Reproductive Justice, we love WURD radio. We love our partnership and all the great work we do to advance the health and well-being of Black women, Black girls, Black femmes, and Black gender expansive people. And so, you know, in terms of reproductive justice, I want to start with how we define that. And I also want to start with that the reproductive justice movement, the term was coined by 12 Black women in 1994. I want to be very clear and unapologetic for those who are listening and participating today. So the reproductive justice movement comes out of the genius of Black women. And so the definition of reproductive justice, as New Voices defines it, is our human right to control our bodies, our sexuality, our gender, work, reproduction, and the ability to form our families. And so for us, you know, we are bold and unapologetic in talking about all the decisions that a woman or a person, a Black woman or a Black person may have to make in terms of their reproductive lifetime. And so we are unafraid to talk about abortion access, abortion care, abortion services. And that wasn't always the case, because we know there's such stigma and shame concerning the choices and decisions that a Black woman or person who needs abortion care has to make. And so it is a very polarizing issue, but for us, it is clear that we should trust Black women to make these decisions for themselves. And so it consistently is a political football, and that our bodies are the political playing field. That's what we're always contending with, whether it's cultural attacks that attempt to shame Black women, whether it's legislative attacks in our state legislatures, and right now in the Supreme Court with Dobbs versus Mississippi Women's Health Organization. The attacks are coming from so many places, but at the end of the day, it is up to Black women to be able to make that decision for themselves. And so anyone, we believe that you can make that decision for yourself, and our job is to protect your human right to be able to make that decision for yourself. Right. And so that has been the work of New Voices for the past 18 years, and really working at the state level in terms of legislation. Can't tell you how many bills have been introduced over the last 18 years to further restrict abortion access. I can't tell you how many times our governor, fortunately we have a governor who has unequivocally stated that he will always veto any bill that's going to threaten access to abortion care. And so we are at a point where we may see the end of Roe v. Wade as the legal precedent.
Yes.
But we also have to look at what is actually happening in the concrete what concretely is happening in the daily lives and lived experiences of Black women and Black folks. And that is the Hyde Amendment, which prohibits federal funds from being used to cover the cost of abortion care and abortion services. That is the case in Pennsylvania. There are exceptions, and there's a lot of rigmarole to even take advantage of those exceptions. And so New Voices in October, we filed our amicus brief, a groundbreaking reproductive justice amicus brief in the case of Allegheny Reproductive Health Center versus the Pennsylvania Department of Human Services, where we implored them to basically make all services available to those who need it. And 43% of non-elderly Black people rely on Medicaid for their health care. So if such majorities rely on Medicaid for health care, then we will make sure they have access to all services, including abortion care. And so that's where I'll start and stop to get this conversation going. But it is the leadership of Black women and New Voices and in the broader reproductive justice movement, which is vibrant, transformative, and changing people's lives in a concrete way through COVID, through white supremacy, through people who want to form their families, and addressing Black maternal health care, looking at environmental injustice. All of those things are on the table for us. And also, we are building voting and political power among Black women in Philly and Pennsylvania, across Ohio, and across this country. So I'll stop there.
Man, that's some powerful stuff. So Marianne, I'm going to pull you in, and then Dr. Sean Ross. Let me ask the both of you this. The research has shown, Lord have mercy, that women of color don't get the same treatment for maternal health care, whether you have tons of money or no money at all. There's also hard data that says we're the ones where our babies tend to die during childbirth, and we are the ones that are tending to die during childbirth. Can we talk a little bit about the care, the maternal health care, or the lack thereof that we're getting through the system, despite our knocking on the door and saying we deserve to be heard over and again? Marianne, I'm going to start with you, and then Sean, I'll go to you. Okay, is that all right?
Sure. That's fine. And I echo Latasha's appreciation for WURD, and Andrea, I have been honored to be able to speak with you and look forward to the conversation that we're going to have. So I want to thank you all for having this platform, because that's one of the things that I would say is important for better health outcomes is conversations, heightened awareness, uncovering the deep-seated inequities that exist that are baked into the system that we currently find ourselves. And it begins with these types of forums, because I'll just be personal. I don't have a lot of, there are doctors and they're very esteemed panelists here. I am representing lived experience and the voice of hopefully our client community, which is that, I, like many other Black women, went into the health system, had 3 cesarean sections when I probably didn't need to, would have loved to have had a vaginal birth after my first C-section, but the doctors were not listening, right? And so why is that? Why, Andrea, do we continue to have the same conversation around these negative health outcomes? And it doesn't matter. It's class agnostic. It's the only thing that it's not is it's consistent that Black and brown birthing people have a different outcome. Why is that? And I just, unfortunately, it's the historical inequities and the fact that we've never been seeing Black people as fully human. I mean, let's go back to we're 3/5 of a person, and that's the root cause of most of these inequities. And I don't feel like I'm saying anything that's brilliant or different. What I do want to say, though, is that the fact that the 5 of us can talk about this today, that these conversations have been elevated to a much more public forum, is the beginning, because knowledge is the currency of change and power. When we collectively raise our voices and we say, we're not going to take this anymore, this is not acceptable, that's when we start to organize and affect change. And so I just am grateful for this opportunity. I think that my esteemed colleagues are going to be able to give you much more of the stats and talk about all the medical things. I'm going to tell you that we need to get band together and just say that we deserve and we must do better.
Thank you. Dr. Ross, I'd love to have your voice in all of this.
So I would say, you know, I would start with the intersectionality of gender and race and the impact, and this impact on the health of Black women is important. I think the intersection of race and gender for Black women is more than just a sum of being Black, and it's more than just a sum of being a woman. It's the synergy of the two, and Black women are subjected to high levels of racism, sexism, discrimination at levels not experienced by Black men or by white women. And so when you think of it that way, and you think of it in the context that structural racism and the experience of chronic discrimination is likely the root cause of these disproportionate health disparities and chronic disease, then you understand why we are at such higher risk for death in childbirth. I mean, it's, you know, we're 2 to 3 times more likely to have negative outcomes than our white counterparts. So, you know, thinking of it that way, you understand why. Now it's time, you know, that's why roles in health equity, or health equity is becoming sort of the buzzword, is that health equity is the acknowledgement that health outcomes do not exist outside of or independent of the social, social context. So it's important for us to acknowledge that there's a problem, and then now start working towards fixing the problem. And there are many ways to fix a problem, but it's now time to focus on fixing it.
So what are some of the solutions that you have, all of you, and I'm including you, Dr. Anuli? The other day, I was at an event in West Philadelphia, just randomly. Woman walks over to me and she bursts into tears. And she says to me, because you sit on the source and you talk all the time about women's health, because you talk about what I should be asking for, because you keep empowering us and telling us that we are to walk away from doctors that aren't giving us what we need to have, she said, I was in the hospital and advocated for myself in ways that I had never advocated before and got such good care. I wish I had thought about it. You know, I wish I'd given myself the courage to have that conversation before now. So what are some solutions that you have for our women and our femme population that are really looking to advocate for themselves? What are some key words that they could use when they go to the doctor's office or to visit the nurse's station and they feel dismissed that may help them to get some service?
So I would, you know, if you guys don't mind me starting, I would say that places that like Independence, where I currently work, Independence Blue Cross, we are focused on patient-physician concordance, meaning that the patient and their provider, whether it's a doctor, nurse practitioner, PA, are aligned in some ways, you know, whether it's racially, culturally, through ethnicity. I think it's important that you find a doctor who understands your perspective. That's one. And then two, throughout my training as a clinician, I'm also a nurse practitioner. My professors always said, listen to the patient. And listening to the patient is more important than actually looking at whatever vital signs or whatever clinical diagnostic tool that you're currently employing, because the patient will feel it before it may show up. And so I will say just that, continue to be insistent and persistent when having conversations with your physician or your provider. And if you're not getting the answers that you want, there is nothing wrong with obtaining a second and a third opinion.
Or finding a whole new doctor.
Yeah.
Yes. Marianne, Dr. Anuli, Latasha, anything you'd like to add to that may be helpful for our sisters?
I'll defer to Dr. Anuli and then I'll speak after that.
Okay.
She hasn't had a chance to talk.
Thank you. So I do want to echo my esteemed panelists and say thank you very much for this forum. WURD gives us the ability to speak freely, which is very important, and also amplifies those voices. And that's equally important, I'll say. So thank you so much. This is incredible. You mentioned, Andrea, already about the data that shows that regardless of socioeconomic status, Black women do poorly compared to white women in maternal care. So there is UNICEF data, so this is international, that shows that African American women in the US, their maternal mortality rates and complication rates are at the level of women who live in Africa. That's where they are. And white women
in this first world country with all access to all the things that we have going on here.
Yes.
Interesting.
And this is UNICEF, so they're an international entity. I was very depressed, frankly, when I heard that, and I was shocked. And when you follow white women, their rates are at the rates of other like European countries. So when people say there are disparities, it's real. There is also data that shows that Black babies are twice more likely to die if they are born of white physicians.
Wow.
So yeah, absolutely. And then the data Andrea talked about socioeconomic class, it actually broke it down. And the highest level it had was college and beyond, right? College educated and beyond Black women, their mortality rates were worse than white women with no high school degree.
Yeah. Yeah.
Say that again, Dr. Anuli. Just say that again for the people in the back seats who think we're making this stuff up.
Right. So college educated and beyond Black women had mortality rates worse than white women with no high school diplomas. So the notion that it's because Black people are poor is false.
Right. It is. Absolutely.
They're not poor. Black people are actually the most educated group in the country.
Right.
The highest graduation rates are Black people in this country. Black immigrants, but Black. And the lowest graduation rates are also Black people, African Americans. So if our genes are the same, if you and I are as intelligent, why is it that when I grow up in Nigeria, where every wealthy, beautiful, rich, powerful person I know is Black, I come to the US and I achieve better than every other group, twice the rates of white people, the Black African graduation rates. But if I were born in this country, me, the same one Anuli, in fact, the data followed out 3 generations. So my rates are in the 80s, my children's rates are in the 80s, right? My grandchildren's rates are in the 20s with African Americans who were born here. So you see clearly that there is no doubt about what's going on. Because I grew up in a kind of a Wakanda where we were limitless, I felt limitless and I passed that on to my children.
Right.
My children never had that experience for themselves. It was just mom who said, you can do whatever you want. And because I said it a million times, they believed it, but they never experienced it. So they couldn't pass it on to their own children. And so those rates fall to the 20s. Yeah. This is data. And at the end of the day, to me, the reason I love data is that it is dispassionate. Yes. Nobody's gonna call you angry. Nobody's gonna call you overly sensitive or crazy when you present data. And so that's Marcella, who my professor from Yale, who was the co-chair for COVID and then joined the Biden administration. She was the one who said, Anuli, give them data. That's what I do. Because when they see data, then you must be silent. So I just wanted to buttress what Andrea says, that there's strong data. This is not in anyone's mind. And then to the point that Dr. Ross made about the patients, I tell my patients, you're not an orthopedic surgeon, but you are the expert of your body.
That's right.
So no one, if you feel this medicine is giving you this reaction, it is. And nobody has the right to tell you that it's not. One of my best mentors, just such an incredible man, is Dr. Bill Levine. He's the chairman of orthopedics at Columbia University. He said, and only when you walk into the room, let the patient speak and just listen. And then he said, how long do you think they'll speak for? I was like, I don't know, 5 minutes? It's like, no, about 37 seconds. So they don't even ramble, you know, but from hearing what they say, you know what is most important to the patient. So I'm an orthopedic surgeon. If you have arthritis in both knees, which I have a patient, the right is worse on x-ray. But to my patient, the left feels worse. I will treat the left. So we can't overstate the importance of listening. Just sit down, be quiet, and let this patient tell you why they're here. And what is the language I use to tell my patient? So I just tell them, tell me. And I have found out so many different things just by listening. And then when they say, oh, but my other doctor is not gonna listen. So I tell them what to do. So sometimes a physician extender comes in first or something. I'm like, say what you have to say. When the doctor comes, when you first tell them, if they don't listen, when they're about to leave, you tell them you have not heard me.
Come on, I like that. That is a great solution. Yes, yes, you have not heard me. Yes. Or the one I say to them is, I don't feel safe leaving here because I don't feel like you rectified the issue that I am having. That makes people turn around. Or when they diagnose you without really looking at you, I said, so how did you come up with that diagnosis? Right. Walk me through the process, please. Frightens the hell out of them, right? Because they're like, oh, so she's really asking. Yeah. Right? It does, Dr. Ross. And it also forces them to see us as people. Nothing irks me more than when we walk into a doctor's office and they're talking and looking at the sheet. And they never look at you until it's time for them to say goodbye. Right. Almost as if, they're doing it because they have to do it. And so we have to find our power as women to say, enough. And to speak up.
I'm sorry.
Go ahead.
And Latasha, if you were, I'm trying to look at all the body language and only insert but I think of a really close friend of mine, 92-year-old woman, who said at church, she said, I've got these issues. I go to the doctor and all they do is go to the computer and they don't even acknowledge my existence. It talk about all the talk about cancel culture and erasure. That is the height of it. But then I try to look at it from the doctor's point of view. Like my kid went through medical school, he's doing family doc stuff, and we don't have enough Black doctors. But he says, Mom, the system is broken. He said, we have to go in, and he has to see all of these patients in a very short period of time. And that kind of like makes it even harder to build in that trust. And it takes time. But we have got to find ways to recognize that the system is broken, advocate for ourselves, and still, that's how we're going to change it from the inside. So I just say, doctor, like you said, Dr. Anuli, I don't feel heard. Understanding that they're pressured too, and just really advocate for yourself. And that's why I think in the maternal health space, doulas are excellent partners because they can help translate some of the things that we have trouble communicating. And it's not just for white women or people of means. Like we have to have Medicaid paying for doula support, right? Absolutely. I see Natasha, you're raising. That's the thing, is finding ways to dismantle the barriers to being treated with humanity. And there are ways that we can do it. We have to do it on a lot of different levels. But I'm just shaking my head with all the things that are being said. And I believe that we have the power within our community, talking about the theme of heal ourselves, heal our village. It's going to take us saying this to each other and lifting it up. And when we fall flat, we just say, you can get up and do it again.
And may I add, when we find ourselves in places where we're not treated well, instead of, we say in Jamaica, instead of sucking salt and walking away, you literally turn around and you write a report to the medical association and you file a formal complaint. If you don't know how to do it, then you ask someone to help you through the process, because that goes on that doctor's records. You know, I want to talk about so much to talk about. I wish we had 3 hours. So I want to talk about COVID and the impact on our mental and physical well-being. Dr. Anuli graciously agreed to be on my show every Thursday to give me the COVID stats, every single one. It started with Dr. Ayla Stanford. She was with me 3 times a week, having the dialogue and updating. And then she came one day and she says, I'm starting something called the Black Doctors COVID-19 Consortium. I said, that's a long word, but okay, sis, let's go. And we began, you know, that's how we got the Black community on WURD, because in interviewing Dr. Ayla the very first time, it was just to acknowledge her as a woman in women's history and the work that she has done. And that was when COVID first started becoming known in the United States. I wanted to get on a plane and she said, don't you dare. I said, that was $800. She said, you're going to lose that money. You are not getting on that plane. This thing is airborne. And people started calling into the station and saying, not happening to us. Black people can't catch it, yada, yada, yada. We find ourselves mostly impacted by it now. And as you can see from the Omicron variant, it continues to happen. In this year alone, many of us have lost family members and friends to sudden death that is unexplainable, to COVID, and to cancer. The toll on our mental health and well-being is incalculable. Right? What can we do? To what end? What do you see in your respective fields? You know, what's happening to us? How do you see us being impacted by this from where you're sitting? I'll start with you, Latasha.
Yeah, thank you. And just, I kind of want to connect the last conversation to this conversation. Yes. And echo Dr. Anuli, who talked about you are the expert of your body. And so in the reproductive justice movement and in New Voices, we say you're the expert on your experience. Like nobody can tell you about what it is to be you and to live as you do. And so I think in terms of how people advocate for themselves, whether it's Black maternal health or, you know, in this age of COVID, there really is this idea that we don't want to confront systems that are often, they are built and designed to marginalize us, to harm us, and in some cases to kill us. And so I think there is in the work that I do, I'm an organizer, I'm an advocate. I know policy, you know, policy is key to so much of what is happening. And so we're finding on the ground in Philly and our other cities is that Black women and folks don't actually know how systems even work to be able to address their concerns. So when I think about Black maternal health care, like Marianne just said, we need to look at Medicaid because it covers so many aspects of healthcare for Black people in Pennsylvania, including Black maternal health. And in addition to the doula coverage, it's about the postpartum care being extended for more than 60 days to a year. And that's work that is happening federally through the American Rescue Plan. During COVID, New Voices moved over $500,000 to Black women and families in Philadelphia, across Pennsylvania and Ohio. And one of the things that came up, I'm gonna make the connection here, is that now Black women are scared to not only give birth, but they're scared to give birth and they're doing it by themselves in hospitals during COVID. And so to really figure out how a person some people may not be able to bring someone into the room at the height of COVID while they're bringing their child into the world. And so that's that intersectionality that my esteemed colleague was talking about earlier. We have to look at systems and policy and advocacy, self-advocacy too, in an intersectional way. And so COVID-19 continues to devastate Black communities, not only on the healthcare side, but on the social and economic side as well. We're talking about social isolation. We're talking about further economic marginalization. And I mean, we served thousands of people over this past year through our COVID-19 fund. And guess what? That need continues from a personal space, my uncle passed away in April of 2020. And it just has never set well with me that someone who, you know, was in fairly good health would pass away from a heart attack as he did. And so I have really been thinking about, I've thought about, you know, was there a connection? Because this is early on. This is April 2020, right after COVID has, you know, really materialized. And there's just ongoing devastation in ways I don't think we can really appreciate. Even the young people we work with through our Sister Speaking project. We created a guide for Black girls to survive COVID-19, a toolkit to support them. So where they're used to coming out and coming to our programming, they're not able to leave their homes. And so they're feeling it as well. So whether it's Black mamas or Black girls or our Black family members who are not sure how to navigate systems already, and healthcare systems during COVID-19, and community resources that are just not readily available. I mean, we're talking about hundreds and thousands of boxes of diapers and menstrual products and emergency contraception and cash grants, because we didn't want to do what everyone else was doing. We were looking at where was the actual need. And then we along with so many partners, were able to step in and just show up in ways that we've never had to before. Yeah. And that changed the very design of our organizing work. So traditional organizers don't do direct service in a lot of ways, but we had to reject that because our communities, our Black communities, Black women are still devastated by COVID-19.
Anyone else would like to add to that? We're good?
Yeah, well, I do want to say something, Latasha. You know, when you said community organizers don't typically do the direct service piece, it's usually, you know, and that's what's kind of interesting about MCC is that we do the you know, we're trying to build out the organizer, we have the direct service and the policy piece. But as I'm listening to all of our conversations and thinking about the devastation that COVID-19 has had, you know, there's just so much misinformation, there's so much polarization, there's so much politicization, or whatever the word is. And for what? I mean, it is really, I'd love to hear different perspectives on how we can get beyond politicizing a public health issue. Like, it is beyond me to really understand why, you know, there's such high death rates in red states and blue states. And I mean, is it a public health issue or not? And what is the proper response? And, you know, I'm looking at the doctors to say, am I missing something? Yeah. What is the proper response to a public health crisis such as COVID?
All right, Dr. Ross, Dr. Amparo?
I would say that the proper response is healthcare is local. We tend to look to these regional hospital systems. The hospital systems are buying up all of the physician practices. Yes. And so, you know, you don't believe it because it's not really in the community that you live in. And so if we want to get past the politicization of anything pertaining to health, it is that healthcare is local, and it is imperative for organizations like Independence Blue Cross, which it already has done, is to support these community-based organizations because they create the pathway to care. And inevitably that builds healthier communities. When you have organizations like Black Doctors, the Black Doctors Consortium, you'll be hard pressed to find anybody in that neighborhood who is obtaining care from those providers to say, yeah, I don't believe what they say. Because that's in the community, they're coming in and out every day, they're talking to them, or they're talking to their grandmothers or their aunts, and they believe them. And so I think we have to get back to healthcare being local, and organizations like Independence supporting community-based organizations.
Like MCC.
Right. Yes, and we do support you guys too. And Black Doctors Consortium and a few others. So.
Yeah.
That's
Could
awesome
I just say
to you.
something?
Yes.
And so New Voices, we actually received hopefully an initial grant around a vaccine equity access project for Philadelphia.
Right.
And so what that means is, it means what you're saying, Dr. Ross. It's, we knock on doors, we call our base of supporters, we text them, we're talking to them on social media about all kinds of issues and topics. But I think that this dispelling of misinformation is critical, but being in communities is essential. And so we'll be launching a program around vaccine equity focused on like the communities we serve, because Black people are not monolithic, and yet we have a variety of intersectional experiences and dealing and navigating different systems of oppression as well. Mm-hmm. And so that work is not just about vaccine equity, but just more focus on health education. Mm-hmm. And I just want to appreciate when Black women step into leadership and fill gaps when systems and government and large corporations do not do that. Mm-hmm. And so we're the first responders. Black women are always showing up to fill the gap, to serve our communities, to make sure our people have what we need. And that is always inspiring to me, whether we're talking about COVID-19, whether we're talking about Black maternal health, whether we're talking about health advocacy or fighting for abortion access. All those things, to me, it's Black women who are the vanguard of what actually works. And that's what I want to say. It's not always the biggest organizations, and it's not always the most well-known organizations that are most efficient and able to pivot to what is going on in real time and in real life in the lives of people that we serve.
And that has been happening for hundreds of years, since the beginning of time memoriam. So Dr. Anuli, anything you'd like to add to that?
Yes, one thing I would like to add personally for Ms. Mays is data I shared with you last week, Andrea, that there is new data from Israel that is showing that men, youngish men, are developing myocarditis after exposure to the COVID vaccine. So it's an inflammation of the
heart, right. Mm-hmm. Mm-hmm.
So you're feeling that your young, healthy uncle just suddenly had a heart attack and wondering if it's related is not unfounded. It's the population was young men, and it was myocarditis, inflammation of the heart muscles.
Thank you.
And I'm very sorry for your loss.
Thank you so much.
It has been devastating. I'm so sorry for that. So I think there is something we have to talk about. I think some of y'all, probably everyone, has heard of social determinants of health.
Yes.
And I feel like when we talk about healthcare, a lot of the time we just jump to talking about healthcare. But with those other things not there, if you don't have good nutrition,
or living in an environment where the water is, not healthy for us, or the soil is not good, or there's a tire shop 2 doors away from where we live, or there's a huge plant in our community where we live, and we're sucking in all that toxin, and we're getting asthma and bronchitis. And let's talk about the lead in the paint in our homes that are old and outdated, the old outdated pipe system. I hear the president talking about the fact that they're getting ready to change every pipe in these United States of America. I sometimes wonder how that's going to impact us in terms of getting the jobs to help lay those pipes, right? Because that's money, that's real money that would help us to move into middle income status. The social determinants is something that we think about and we wonder, because you see clusters of people getting cancer, clusters of people, different things happening, but we don't really talk about it. So I agree with you, Dr. Anuli. Continue in that strain of thought as you were going along.
Yes, please. So, and then another thing that I think people don't understand is that healthy nations are wealthy nations. And I mean straight up GDP, dollars and cents. So if you have healthy people who can work for decades and decades and decades, if you have healthy people, as we know, most of healthcare dollars is what? For Medicare, it's diabetes, right? That's where it goes. A ton of money is spent in the last few weeks to months of people's lives. A ton of money are chronically ill. So all of that money, if we would put it into making people healthy.
Preventive care, yes.
Then that's extra money the government doesn't even have to spend for a population that then works longer, produces more and boosts GDP. So nobody is even asking for a handout here. We are telling you, you make more money by keeping us healthy. So try to keep us healthy.
And you know, Dr. Oh, sorry.
Sorry, no.
No, it's just.
Oh, sorry, please go ahead.
Finish your thought.
No, then I was just gonna say, so there was a look at 2 different countries, one in Asia. It was either South Korea or Singapore. I haven't looked it up in the last few months, so I forget which. And the other country was in the UAE. One country pumped money into its society, so UAE. The other country fixed healthcare.
UAE's United Arab Emirates, right?
Yeah.
Okay, got you. Okay.
And then the Asian country fixed healthcare, access to care, the determinant stuff. Their GDP went way up.
Right.
It was a shock. And the country that pumped money and gave economic responses, it went up, but then it plateaued. So when I actually have seen the charts for these, and so they are real things. There's enough data that shows that we should start focusing on keeping people healthy and compensating physicians, nurses, everyone for keeping patients healthy, rather than just taking care of people who are already sick.
I think
so why do we, because that is, why do we not do that? Why does this country choose to invest in disease management rather than prevention?
And not even, right, because they're fixing it's a symptomatic, right? They're not even fixing the problem. They're not even getting to the root of the problem. They're just giving you medication to ease the burden that you're feeling.
And there's a reason.
Right? And
Dr.
so,
Ross
go ahead, Dr. Ross.
I think the reason is those political determinants of health. She mentioned, Dr. McFarland mentioned the social determinants of health. I know Latasha is probably very well versed in the political determinants of health. That is going to take a dismantling of the current system, and I'm talking all the systems. I am talking HHS. I am talking how Congress runs. It is going to be a massive undertaking to do. And because it's going to require so much, it's never done. And so why we are now focused healthcare as an industry is focused on improving those social determinants of health, because it has so many implications for health. And you have CVS as the company in housing now. You have Aetna focused on food insecurity.
Yes.
Because they realize that going through the political focused on the political determinants is going to take another 100 years.
Right.
It's best that we focus on these social determinants, and healthcare try to fix itself in order for change to happen.
So go ahead, Dr. Anuli.
I actually, I was applying for a White House fellowship. I don't know now if it's this year or last year. COVID has got me confused. But they asked, one of the questions they asked was, if you were president for a day, what is the one mandate you would make? And from my time in business school and classes we had taken, the mandate I wrote was that I would mandate that all health insurance companies provide life insurance to the people for whom they provide health insurance.
Interesting.
Look at that. And they oh, I love it. Then they would have to figure out how to keep people healthy, so they would have to pay those life insurance policies. Look at that.
That's great.
Look at that.
So, and that way, now you are incentivizing people to do what you want them to do. You want them to keep people healthy and for a long time, pay them to do that. Right. So that was my, that was what I wrote the essay on. And because I felt if there was one thing, because to Dr. Ross's point, the alternative, there's so many things to have to dismantle. And this is, let's be honest, we are a capitalist society.
Right.
So once you start providing solutions that take it out of the market,
Yes.
you are always going to meet people who don't like it.
Mm-hmm.
Partly because we fought a monarchy. We were in a system where we didn't have this freedom. We didn't like it and we left.
Mm-hmm.
So I was like, you know, if we had a capitalist solution, it's not big government.
Mm-hmm.
The only big government involvement is the mandate.
Mm-hmm.
And then, you know, insurance companies will then get paid on both ends, you know,
Right.
and so they figure that stuff out. So
Mm-hmm.
I'll vote for you. I'll vote for you.
So listen, we have literally about 5 minutes left. And I want to use these last 5 minutes to talk about any solutions that you may have, simple to more complicated ones for our listening audience. You know, our folks listen to us. They hear what we're saying all the time. One of the things that I tell them consistently is choose what you're putting in your mouth, right? We talk about growing things in your own little garden, starting your own tomatoes, cucumbers, learning how to absorb and love those things versus the things that we're raised on eating all the time, especially as we get older. Younger and younger children are being diagnosed with diabetes. I believe it's the stress plus the food plus the social stuff that's happening that's causing folks to get sicker younger and younger. So what are some of the short-term solutions that you have for folks who may be looking at this, looking at us talking and saying, I don't know where to start? Anybody? Partnership. Say more about that.
The fact that, you know, when Latasha talked about community organized, I can't talk today. And and direct service, or Dr. Ross talking about what is happening even with CVS, and it's really understanding what is my value proposition, what is it that I, MCC, or I, Independence, Blue Coat, I, you know, New Voices, all of these, and then how do we strategically partner to get accelerated impact?
Agreed.
And not be like, this is my, you know, be turf oriented. I'm all about, I want to be part of moving the needle, and it can't be MCC alone. It has to be in collaboration and that local piece. So that's what I'm taking away from this, and I would share it with the listening audiences. Figure out what you have, what somebody else have, and together put it together, and let's break some of this stuff down.
Let me piggyback off that, Marianne. I think at Independence, we have partnered with Penn, we've partnered with Jefferson. Actually, I'm not even going to list them. We've partnered with all of the hospital systems in the Southeast PA region to create Accelerate Health Equity, to do just that, because we recognize that it's going to take a portfolio approach to dismantle racism and to dismantle these health disparities throughout our region. And then for a practical solution for the listeners, Independence incentivizes you for getting preventive care. Find a doctor, one that you like, and go get your preventive care. And, you know, we'll figure out ways to give you little things that are tangible for you, whether it's a car to go grocery shopping or whatever. We incentivize that. Prevention is better than cure.
Sure, agreed. Latasha and Dr. Anuli?
Well, for me, in all things, I would quote Bell Hooks. I'm rocking my feminist sweatshirt, a proud Black feminist. And the quote that always inspires me and moves me is to move from silence to speech is a revolutionary act. Wow. So in everything that we do, and is the pursuit of our health and the care of our families, the creating communities that we want to see, to speak is one of the most powerful tools that we have to change our lived experience and to change our lives.
Right. Thank you, Dr. Anuli.
My answer is going to feel very trite. I was going to say, you know, I have a gratitude practice that when I wake up in the morning, I literally list the things I'm thankful to the Lord for. And honestly, that list is very, like, in under like a few minutes, I have like 20 something things. I'm like, whoa, this is a lot. And I feel like that helps me feel optimistic going into the day. So that's one thing that helps me a lot, is the gratitude practice. A second thing I do is something called a mood meter. It's an app that someone showed me. It's a free app where it asks you, what are you feeling now? And it makes you go through naming it exactly and then asking you why. And then it asks you, do you want to remain here or do you want to leave? So I think, you know, being more in tune with what you're feeling. We are under pressure. We have been locked for 2 years and there's no end in sight. We should, you know, it is normal to feel like we've lost something. So parts of this are normal feelings. And so we probably shouldn't have anxiety about feeling appropriate situational sadness. So some of those things help you sort out, what am I feeling? And is this appropriate for me at this time? Or do I want to pivot? And then it gives you like words of wisdom, like what Letitia just shared and things like that. So those are 2 things I do a lot, just for myself to feel centered, because I feel like that's where it begins. And then the final thing, professionally, I do many things all the time. But I try to set a small task for every day. So, I'm going to read my, radial nerve chapter today. And it's so small that in the midst of everything I'm doing, I know I can do that. So that no matter what happens, I go to bed knowing I've accomplished one task. So that's something I do as well.
All right, it's time for me to wrap. I want to thank you all so much. Latasha D. Mays, who is the founder, president, and CEO of New Voices for Reproductive Justice. We have Dr. Sean Ross, the executive director of Health Equity at Independence Blue Cross. We have Dr. Anuli Emparu, who moved from Boston here to Pennsylvania, to Philadelphia, to help with the opioid crisis here. We didn't even get a chance to talk about that. Well-known orthopedic surgeon. Marion Frey is the chief executive officer with the Maternity Care Coalition. I want to thank all of you for having a great discussion with us. I'm going to read one thing from a listening audience. Viola, she said, my husband came home after Reagan had cancer. No more red meat. A lot of food I don't eat since I had breast cancer. I'd love to be able to invite all of you back to the source so we can have consistent conversation around our health care. What can we do differently? So please look out for that from my producer, Brianna. I want to thank all of you for being a part of this conversation today. Stay well, be well.
Thank you.
Thank you, Andrea. Thank you, everybody.
Bye.
Have a great
Stay
end of year.
safe.